Okay, I will start. Thank you for having me here, and very interesting meeting, and thanks for choosing this topic to be part of your agenda today. So the extent of gambling-related harm, misunderstood and overlooked issues. I think that this is a very important topic that we saw a video. There is some under-research on certain important aspects, and I will discuss in a few minutes more about them. But first, I will speak a little bit about the current situation in gambling research, especially in relation to problem gambling research. Then I will have a few words about gambling as entertainment, because this is one thing that the industry always paints it. And gambling and serious harm, and industry and self-regulation, whether that's possible or should there be more regulation as it's currently happening in Spain, Italy, and many other countries. And hope that we have a few minutes for discussion before moving to next speaker. And of course, you can place questions and comments to chat also. So the background is, as many of you know, that there was great gambling expansion in Europe and other countries in 80s and 90s. As it was the case before that, there was lots of emphasis on consumer protection, prevention of crime, fraud. Usually the gambling was located in Ministry of Interior. It was a matter of national security. It was a matter of police. It was a matter of these kind of things. But nowadays we increasingly see that gambling is located in, like in Sweden, to Ministry of Innovation, Ministry of Enterprises. Gambling has been more as business as usual, entertainment as it's in other fields. And there is always, however, this emphasis on problem gambling and its consequences. But I think that many of the researchers, at least who work in addiction, think that prevention of problem gambling, it requires influencing all users. If you think, for example, tobacco, like the cases where there has been changes in law, changes in legislation. If you go to Greece and other countries, lots of decrease in tobacco smoking has been because of the legislation that's influencing all users, not only those who are problematic smokers. Or if you go to the field of alcohol, it's always that you influence all the users. You place the limits on venue opening times, you place limits like here in Finland. We can't buy alcohol after 9 p.m. We can't buy alcohol before 9 a.m. So you have certain hours that you go to the shop and you have to buy the liquor if you want to. So that means that in gambling, it's always more effective to influence all the users. But the difficulty is that problem gambling brings in so much revenue. It brings up to the 2/3 of the revenue, at least here in Finland. 7% of all gamblers bring in 50% of the revenue, so it's heavily concentrated. There is also issues with measuring problem gambling. We have lots of population surveys. They have been conducted across the jurisdictions for decades. We know quite well that problem gambling in general population, it's usually 1, 2, 3% of the population, adult population that it's. But we also know that there are serious problems with these kind of measuring instruments. These are usually phone surveys. People don't answer the phone. They don't want to discuss about gambling. It's something that they are ashamed of. They don't want outsiders to know the issues that they're having with gambling. These kind of surveys, they don't reach people who are in prisons. They don't reach out for homeless people. They don't reach out for minorities, immigrants. It's also the case that these kind of surveys, they are not longitudinal. They are based on self-reporting. It's always the response bias. You don't get the answers that you want to. Then it's the case that the amount of problem gamblers, it's always higher if you show that in relative to gambling population. As you know, most of the people play only lotteries. Very few people go to casinos. Even few people spend time with betting on sports. There is not a majority of population who is involved in these kind of activities. And if you think people who gamble regularly, for example, each week or even each day, there is even smaller population. But when you look at the slot machine gamblers versus other gamblers, also you look online versus offline gamblers, you start to show differences. You always see the problematic amount which is emerging from the slot machines. And there are surveys like this kind that they always draw attention away from government industry partnership. Government is usually to protect people's health, but in this case they usually try to enable gambling taxes. They want to increase the amount of profit that it's coming from gambling. Like here in Finland we have gambling monopoly, it's owned by government, and it's constantly advertising its own products. It's bombarding people with gambling marketing, but still we try to prevent outsiders, offshore gambling companies from Malta and Gibraltar to entering the Finnish market. But nevertheless, there is a huge amount of harm that it's coming from the gambling monopoly itself. There is always the conflict of interest, COI, as you call it in the slide, that it's coming from gambling industry when they place lots of money on the table and say, do you want the taxes, do you want the jobs, do you want the things that gambling can provide in terms of money. And with gambling research, it's also the case that in Finland, I have understood that also in Slovenia, it's quite small field. There are only few people who are working in this field. Usually the money for research, it's for treatment. Government gives it for treatment, but in very few cases, it's for other research. So we have to focus on individual factors, personal issues, disturbances of mental health. And this enables the industry to paint the gambling as individual weakness. Last week I attended Responsible Gambling Conference, as it was called, in Amsterdam. It was hosted by Kindred, which is a major gambling operator in North Europe. And it's always, the discussion was only about responsible gambling. It was about problem gamblers. Without them, the gambling industry would be pure entertainment, but unfortunately there are only few people who can't really gamble properly. This is the narrative that they want to advance. So the solution to problem gambling is find out the problem gamblers from the population and cure them. And for this purpose, we have industry self-regulation, we have voluntary codes of conduct. People can self-exclude themselves from the gambling venues like casinos in Slovenia and other places. But the operators itself, it's very rare that they are punished for breaches. They are not accountable for things that they are incurring in population. So in my talk today, I want briefly to touch upon the issues like, is gambling truly a form of entertainment? I will give a few words about that, and we may discuss more about that in the end. And because of the video that it was shown in the beginning, this Gambling with Lives organization located in UK, I thought that we could discuss a few words about what kind of harm is caused by gambling. Is there grave harm from crime? Is there grave harm from suicide? Because industry claims that if there is a harm, it's always minor. It's not so big thing. It's something that people lose money and then they have some therapy and they move on with their lives. And we wonder if this is truly the case. And lastly, I say a few words about effective regulation. What is self-regulation in this field? It failed in case of tobacco. We saw it fail in case of alcohol. And now we are seeing signs and hints that it's not working in gambling industry either. So gambling as entertainment. We have other entertainment, in many cases, free of charge. You can think of parks in Slovenia, you can think of art exhibits that you visit, fairs, festivals, museums. In many cases, you can have it for free. But in gambling, it's always the case that you have products and services with a cost. If you have entertainment, like in casino, you have to pay the entrance fee. It doesn't come free. If you have bonuses, if you have anything else provided by the gambling company, somebody is going to pay. It's other users, or it's you when you enter the gambling facility or buy the gambling product or service. So the purpose of gambling is always to enable the monetary transactions. The entertainment is a side product of gambling. It's the feeling, or whatever you want to call it, excitement or something, when you buy the lottery and you have a hope that you will win something. You have a hope of better life, you have hope of vacations, you have hope of providing your family or anything like that. And for this purpose, in order to create this desire for hope, the gambling companies want to incite loss-making customers. They have specialist staff in casinos that are designed to host VIP consumers. But if you think, for example, gambling machine, what kind of entertainment it's designed to addict. It's designed to make more time on device. Whenever you gamble more than 1 hour with gambling machine, most likely you are an addict. 60% or even more of the revenue from the gambling machines located in non-casino venues, like here in Finland, they are in shops, they are in groceries, they are not confined in casinos, they have been even in swimming halls and hospital cafeterias. You have the most of the revenue from machine, then you have it from the addicts, people who have been addicted to gambling. So the entertainment value of gambling, I would say that it's highly dubious. It's very difficult to speak even about that. Unlike in other entertainment, if you go to watch a football game, you go to watch a movie, you go to opera or any other form of entertainment, you always buy the ticket on the counter or from the net. You know the price of the game, you know it's 20 euros, it's 40 euros, it's 50 euros. But when you go to gambling venue, you place some money in the machine, you win some, you lose some, you loan something from your friends, you loan something from the bank. At some moment of time you lose the grasp how much money you are losing. And in case of other entertainment, it's always voluntary. You can choose freely whether you go to museum. You can choose freely whether to watch movie. Nobody is watching movies compulsory. Nobody is spending time watching soccer because he or she is addicted. But in case of gambling, there are always part of population who is addicted. There are people who have children. They can't choose with the parent goes to the venue. There are other concerned significant other CSOs, as they are called in research, who are worried whether the money that should be used for living is being consumed on gambling against their own will. And even if we talk about gambling providing consumer surplus, as economists call that, it's always very small or negative. It's spending that it's disproportionately concentrated among certain small group of people, as I already told you. So how we are to assess the cost of gambling then? So we have markets in our modern society which are very valuable in assessing the total cost of something. We have goods and services, they generate prices, and we can place a price tag on something. And we can also say that something that rises or lowers, increases or decreases well-being is also something that we can measure. So market prices can be assigned even in this kind of activity. So we can calculate the social cost of the activity. We can calculate some things that are associated with market values, and then we have some things like negative feelings, stress, this kind of things that are mental states that we can not so easily assign value, but we can nevertheless measure and estimate them based on psychological appointments, hospital visits, value of the hospital staff time, used for this kind of purpose. So based on these studies, which has been conducted for decades in many countries, and now I don't know about Slovenia, but in Nordic countries, I will show within a few minutes what kind of studies they are, and they usually revolve around of issues like abused money, bankruptcy, crime costs, cost to employment and business, illness costs are quite clear, visits to hospitals and other municipality health centers, family costs because of divorce and other issues, regulation costs, cost of policing, and cost of suicide and healthcare services. We have such studies. I can show a few of them very quickly. You can browse for the net. I have always attached the source where I have taken my information. You can probably have these slides afterwards. You can return them if you want to. One major study was conducted in Victoria, Australia in 2018, and it showed that it's up to 7 billion Australian dollars that it's consumed by gambling because of treatment, because of harm. It's up to 4.5 billion euros in a year. And if you think that 85% of the harm was not for the problem gamblers, it was low or moderate risk gamblers. And this is rather interesting because it's the same case with alcohol. If you think alcohol harm, it's not always the alcoholics who incur most of the cost. There are also other costs. When you drink little amounts of alcohol, you have an accident, you have harm already before you are an alcoholic. That's quite easy to understand. You might have a fight, you might have a transgression, you might drive under influence, even though that you are not considered as an alcoholic. The same case is same with gambling. You don't become problem gambler during the course of one night. You start to have problems even before. The cost of gambling was measured in Sweden in the same year. It was calculated as 1.42 billion euros, and it's very high amount if you think that Svenska Spel and ATG, which is the monopoly for horse racing, the total revenue for both of these companies and lotteries were 700 million euros at that year. So it was twice the amount. And if you think cost of gambling in Norway in 2021, it was up to 5 billion Norwegian crowns, which is 500,000 euros, equal to profit of government-owned Norsk Tipping. So how do you assess the cost and benefits? You take the tax benefits of gambling venue, but when you calculate the lost taxes, when the money is shifted from other businesses, it's the reduction of unemployment, lost job opportunities. You have to note that you lose jobs in other businesses without gambling money. Even though industry says that they are producing lots of employment, there are lots of people working in gambling venues, in casinos. But you will notice that in vicinity of casino, people start to visit casino restaurant instead of going local restaurant. There are jobs which are lost in neighboring areas. And if you have benefits of gambling, all benefits tend to decrease over time because people lose their assets, people lose the money that they have to loan, and in one moment of time they are not able to recoup their losses. So you have to have more gambling to uphold the revenue stream. You have to ask for government to lose the restrictions. You have to introduce new gambling form. First you have lotteries. Then you have gambling machines in designated venues, like in Slovenia, they are mostly in casinos. Then you want to open up the online gambling market. You say that the money goes to Italy, money goes to Malta if you don't have your online gambling regulation on your own. That's always the claim. You have to have the money because the harm is staying in your own host country. But if you look like the Italy, which has been doing this for a long time, Italy opened the gambling market online business licensing in 2012. It has been doing that for a decade. This year, one study was published in the critical gambling studies. It's open access. You can access it freely. You don't need to have university account to read this paper. It's very interesting from the critical gambling studies social cost of gambling harm in Italy, because they break down all the fields quite detailed manner. They saw the healthcare cost, which is up to 60 million euros. They have calculated the unemployment and productivity loss, which is over 1.2 billion euros. Family costs are 9 million euros. And what is interesting, what is often not the case, they also calculate quite detailed price tag for crime and suicide. And this is the topic that I want to spend rest of my presentation. I will deal with the crime and suicide because they are often not dealt with these kind of discussions. There is lots of discussion about cost of treatment, which is important. But if you think about suicide, you lose the life that could be productive. You lose amount of productivity. And crime costs, they are often hidden. So I will highlight, based on one US study, what kind of costs they are in relation to casinos. So let's move on to gambling and serious harm. And first, casinos and crime. So when you introduce a casino to certain country or jurisdiction, you have always impact on other entertainment. We have done a study with my colleague Virve Mariano, who is located also here in Helsinki with me. We looked at the issue whether the gambling harm or benefit other industry. This was our review and published in Journal of Gambling Issues 2 years ago. And we noticed that there is always extra competition from existing providers. There is increased social cost. There is a problem gambling rate, which is much higher, 50 miles or 80 kilometers from casino than other jurisdictions if you don't have a casino. And if you have cost-benefit studies which are produced by gambling industry, they are always lacking some information. They are not impact studies. They are not taking into account the increase or decrease in well-being. Because if you work part-time in casino, you have a job in casino, you might need more childcare because it's late hours, it's evening shifts, it's working in night time. You might demand more childcare, you might demand still social services because you can't make out of your living. These kind of jobs are often low paid, they demand less education. So the impact on the society as a whole, it's not so great as the industry often claims. And what kind of harm it's that I will show only briefly what is the corruptive influence and what is the impact of crime, because this is very contested issue. Those researchers who are sponsored by the gambling industry, they always claim that it's something that you can't show. But there are some studies like one paper from the Institute of Labor Economics in Germany, Nichols and Tosun, they went through almost all the studies and they saw that it's always a correlation between casinos and crime. There is no study that wouldn't show any correlation. And if you look United States, this is one of the few empirical studies about the matter. Researchers who were two economists, they went through all federal corruption cases in all US states between 1985 and 2000. 5 US states with lowest level of casinos, lowest level of corruption had no casinos. But 5 states which had the highest case of corruption, there were 4 out of 5 were casino states: Mississippi, Louisiana, Illinois, and South Dakota. Only state that didn't have casinos was Alaska, but all of the corruption there went to the oil industry. So they had industry which was strong presence. They didn't need the casinos at all. They didn't want the casinos, but still they had high amounts of corruption. It was only replaced by oil industry, not the casino industry. So the researchers stated that there is more than correlation. It's industry itself and its culture of corruption. It starts even before the introduction of casino. It starts 1 or 2 years before opening of the casino, because industry is bribing the official industries hosting the events for state officials, industries producing gifts. And then the impact of crime. This is one of the most comprehensive studies that I have seen during the course of my 10 or 15 years of study that I have been working within the field of gambling. They used county level data between 1978 and 2006. This was the time when the casinos, amount of them went up from 14 casinos to 180 casinos across the United States. They measured the level of crime 2 years before casino, 4 years after casino in a county. County is a little bit larger than municipality. It's I don't know if you have such in Slovenia, but it's a combination of municipalities, combination of small towns. Might be dozens of them, might be only few, but nevertheless, there are 3,165 of them in the whole United States, and they went all of them through. And they looked whether they have a casino, and if they did have a casino, then they looked the crime level compared to neighboring casino, the neighboring county that didn't have any casinos. And they used this uniform crime report for Federal Bureau of Investigation, which is the central bureau for policing in United States. They have index 1 offenses, which are always reported in uniform manner. They looked 7 crimes, violent crimes, aggravated assault, which is always very serious crime. You hit or punch somebody. There is a rape, there is a robbery, there is a murder. And they are always reported in a similar manner for purposes of statistics. And then you have property crimes. You have larceny, which is not exactly the same of theft. It's always the case that you take some property which has value from the car or similar place and you sell it. That's a larceny. Theft can be also other things. You can take something immaterial. Then you have burglaries. Then you have auto thefts, where you take a motor vehicle without permission. And the results, hope you can see it, but if you go from the upper left-hand corner, there is an aggravated assault. So you punch somebody, you take this kind of violent action against somebody in the street or some other place. The red line is the casino county, and the gray line is the county without casino. And you can see the red line is going upwards 2 years before, 4 years afterwards. 2 years before, they are quite in a same line, but after 2 years, it goes rapidly up. Then there is upper right-hand corner, at least for me, and I hope to you also, about rape. Again, they go quite similar manner until the opening of the casino. But after 2 years, the red line, the casino county, goes straightforwardly upwards. Even though it goes upwards in the county without casino, there might be a spillover effect, but still it's higher in case of casino county. And if you look at the lower left-hand corner, there is a robbery. You still see very clear difference. There are robberies much more often in the casino county than non-casino county. The effect is much more higher if you take that compared to rate of 100,000 population. You see clearly that there is more than correlation. It's clearly the causality. Only thing that doesn't correlate in this slide, it's the right hand lower corner, the murder. And what is the reason? It's not always the case that there wouldn't be murders in Las Vegas. It's the case that you have murders in Atlantic City, you have the murders in Las Vegas. But the case is that you don't have murders in all of the counties in the United States. Even though you have lots of crime in the United States, you might think based on the TV series that there is murder in each and every county in the US, but there is no such case. So you can't really compare that statistically. You would have to have at least one murder in a county in a year so that you would have the opportunity to compare it that statistically. So we can't really do the research on that matter. And if you look at the property crime separately, you see the larceny. Again, it goes hand in hand and almost tandem with the non-casino county. But again, after 2 or 3 years, the larceny goes heavily upwards. It doesn't go immediately, perhaps because there is lots of more policing when the casino is opening. The counties invest more on police first, they hire more police officers. But after that increase in police first goes away, the impact of crime also goes upwards. The case is similar with burglary. If you go after 3 years, the case is much higher in case of burglaries, in case of a casino county compared to non-casino county. In case of auto theft, it might be that it's already higher in these kind of locations that have gambling and they have already the auto thefts, but still you have the difference which is growing rapidly after 3 and 4 years. So the results of this quite detailed study, which unfortunately hasn't been replicated in Europe, but I hope that somebody would replicate that. It showed that in terms of United States, the 8.6% of the property crimes and 12.6% of violent crimes were because of the casino. And to the extent that communities with casinos actually invest the law enforcement, it's entirely possible that casino impacts on crime are understated rather than overstated. And this is very high impact already, if you think 8.6 and 12.6%. And the industry claims that it's the large number of visitors. Whenever you have large number of visitors, then you have crime. But that's not the case in case of national parks. We have study produced by same group of researchers, Professor Eric Reynolds and his colleagues, who did this crime study, and they looked for national parks in US. They have very high amount of visitors. They have almost no crime. And if you look the large shopping centers like Mall of America, which is largest in the US, they have 2,000 shops. They have visitors almost 8 times higher visitor level than Las Vegas when you adjust that in the population. But still the crime rate is only 1/15 of Las Vegas. Then that was about crime, and it was about crime and casino. Sorry that due to the constraints of time, I can't go through all the crime levels in other fields that are related to gambling, but it's just showing that if you think casinos, what kind of things you can measure if you want to. Also in Slovenia, perhaps if you go to police records, if you want police to follow up these matters in casino counties or municipalities, Nova Gorica and others. Then we have gambling and serious harm, and we think about suicide for a moment, because that was the video that we saw in the beginning. So the suicidality, it's clear that there are suicide attempts. Usually there are many more attempts than actual suicides. It's the case that people try suicide, they will fail, and somebody finds the person, somebody is taken to hospital before the actual deaths, and then we have the suicides that are successful, and there is also self-harm because of the inflicted gunshots and other types of actions. So we find positive association always in review studies. We have just actually today, we have published a review with my colleague in Frontiers of Psychiatry. We did a systematic review of qualitative evidence. We found out that 20 studies have been browsing the issues, and it's always 2 main processes. There is in-depthness, the money factor, and there is shame involved. And this is too great for them to bear when they end up to having the suicidal tendencies. And again, the gambling industry states that there is no evidence of causality. You can't perhaps have the incontrovertible proof, but you can't have it in any other realm of public health research. You have to use different factors. You have to look, in case of tobacco smoking, you have to look also the possibility that person has lung cancer because of environment, because of work-related matters, but they are a very small portion of all lung cancers. If you have lung cancer, up to 90%, 95%, it's always tobacco smoking. There is always this few percent that it's something else. And of course, in case of heavy gambling, there might be few percent of the suicide, which is something else. But if you look the general issues, you note the depression, anxiety, obsessions. We have a psychologist who is talking after me, so I won't deal with them in here. But I only say that the suicidal ideation is common. Approximately 20% of those who have been classified as problem gamblers attempt suicide at least once during the course of their lifetime. And if you look gambling locations where there has been gambling for a long time, we have United States of Nevada, state of Nevada in the US, where Las Vegas is located, the most famous casino destination in globally. The suicide rate of those over 65, it has been for decades twice as high than other places in the US. Nowadays it's the second, but it used to be the first for a very long time. And if you look the residents of the city of Las Vegas, the suicide risk when they went through up to 3 decades before the study that was published in 2008, they had 50% higher suicide risk compared to other metropolitans in the whole US. So it means that the rate is very high when you have gambling. Of course, there are drugs, there is alcohol in Las Vegas, but it's not so great differences if you compare that to Detroit, you compare that to other major US cities where there is lots of poverty, lots of differences between the areas. I saw also few studies from other continents because all of them tell different sides of the things. So this was one study in Melbourne, Alfred Hospital. They noticed that they had up to 900 suicidal patients in 1 year. 17% of them reported gambling when they started asking. And they went to the Victorian, which is the state where this Melbourne is located, coroner, and went through all the suicides where there was investigation of the reason. And they found out 128 suicides, and they noticed that the peak of the age group is in 30s. It's unlike in other suicides, that male 85% are predominant. And if you look at state of Victoria, it's conducted one survey in 2009, and they noticed that 12,000 Victorian gamblers had contemplated suicide. It was 1.8% of the total population, even though the state gaming minister said that only 1% of the population are problematic gamblers. So you see that the harm of gambling starts even before you are designated as a problematic gambler. In Canada, they had 2 general inquiries on suicides in 2003. In province of Alberta, 10% of suicides were related to gambling. In Nova Scotia, 6.3. And in province of Quebec, they went through all the coroner's reports during the course of 10 years, and they found out 156 suicides related to gambling. Risk factors were again debt, depression, relationship issues. But most important, over the half of the cases was availability of gambling machines. And how the researchers were able to tell this. It was the case that person leaves a note behind. This is usually the phase that the persons don't want to lie anymore. They might have family, they might have children, they might have loved ones. They want to leave a written note or something where they explain why they did it. And this is something that in very few cases people lie, because whenever they survive the suicide attempt and they have been questioned afterwards, they tell that it was a honest statement. They don't want anymore. They have been lying all the time, and now they want to tell the truth. And in half of the notes that were found after the person was deceased, it was the case that they blamed the gambling machines. And in Hong Kong, there was a major study also in 2003. They went through all the coroner's report, and evidence of gambling behavior was present in 233. It was the bank account statements, it was slips that you were showing the visits to casino. They had cards from casino. There was a similar amount of proof when the investigators went to home and questioned the relatives. And out of 223 suicides in 2003, 110 were indebted. So it means that very many persons had gambled in casinos and they had debt. And this was in stark contrast with people without debt. They were almost always going to casino. And other suicides, when they went through, they were always older persons. They had unemployment history, they had divorce, they had mental illnesses. But when you had gambling related, they were different. They were almost always, again, people who were in their 30s or 40s. They were married. They had no history of mental illness. Almost always there was nothing. There was no visit to psychologist. There was no visit to psychiatrist. So this tells us that when you enter the treatment, it's perhaps too late for many. You have to have prevention. You have to have effective prevention if you want to prevent these kind of things happening. And this was perhaps the most nationwide study. It was a registered study in Sweden with persons with gambling disorder. It used to be problematic gambling or pathological gambling, but nowadays it's gambling disorder in psychiatric manuals. Again, there was a risk factor of depression. If you contrast this with all-cause mortality, where you have high age, cardiovascular disease, this is different again. And if you go through all the age cohorts from 20 years to 74 years with persons who are diagnosed with gambling disorder, you have 1.8 times higher mortality. It's greater even with females than males. And you have 15 times higher suicide mortality compared to normal population in Sweden. So this is very great difference. And if you look the age cohort of 20 to 49 years old of age with gambling disorder, it's 6 times more higher mortality. And in case of females, it's even 10.5 times higher. So it gives even more impression how confined this problem is confined to younger age cohorts. And this is the time where you should be productive, you should form a family, you should raise your children. If you lose a person for a suicide in age of 30, age of 40, this is very costly to the society. It's because after the education, after university studies, after other studies, then you are supposed to enter the workforce and pay back in taxes. And you lose this amount when you die in a younger age. Unfortunately, I would hope to say that there are much more studies about the issue, but there is lack of studies. And reasons for this, there is lack of funding, there is lack of interest. Canada, they stopped collecting data. Perhaps it was so inconvenient, they wouldn't continue, they wouldn't fund these studies. BBC, the British broadcasting company, asked for government officials in Australia to comment. They politely declined. So there is very little public discussion. And I think that it's the same, and it's something that we as a society have failed if you can't discuss this kind of matters publicly. If you want to speak benefit of gambling, taxes of gambling, profit of gambling by the gambling industry, you have to discuss about this kind of issues, gambling and crime, gambling and suicide. So the last few slides I have, I know that I'm running out of my time. I very quickly show the case in Australia. Crown Casino was investigated whether they are capable of self-regulating themselves. They asked from employees 225. This is very simple study. It can be found from the web. It can be replicated in Slovenia if people want to. If the people want to interview anonymously people who work in casinos in Nova Gorica and other places, it's possible if you have the permit. You can ask about level of violence, problem gambling, and alcohol abuse. So the results were that there were people who were gambling long periods of time, 24 hours or more. They didn't leave the casino at all during the course of time. They were relieving themselves. They didn't want to leave the machine. People who were part of the staff didn't do anything. They didn't report the issues to the supervisors. There were people who didn't advise the gamblers take breaks. They didn't intervene if they saw problems. They just looked away. The case with alcohol was similar. People let the persons gamble intoxicated. Half of the people were able to gamble even though they were heavily intoxicated. Many of the staff told that they don't feel safe at work. There are fist fights. There are up to 30, 40 fist fights or brawls in this one casino only in Melbourne. It's a large casino, but still. There were up to 40 people who were evicted during the course of the night. They were just thrown in the street, and the staff said that they are going to be dangerous for other people. There were lots of injuries, over 200 reports of serious incidents. There was one attempted suicide even in the casino premise. People who are not leaving even casino to try to suicide. They had strokes, they had heart attacks, they have sexual assaults. And there was a practice by casino to call taxi instead of ambulance, even in case of serious harm, because that's why they avoid ambulance report, police report, negative publicity. So there is ineffective regulation in casinos. There is lots of discussion and talk about fair play, informed consent. There is provision of general guidelines. The casino staff provide helpline number, but that's pretty much about it. If you have a return percentage like that you get from the machine 85% of money back, what does it tell you? If it's 10,000 spins, 20,000 spins, it doesn't tell anything for the person. He or she would need much more detailed information about odds of winning, the gravity of harm, what are the results of harmful gambling. So what we would need instead, there would be mandatory time awareness, pop-up warning messages, cash rather than credit displays on machines, slowing the speed and event frequency. You can have 13 spins in a minute with machine gambling. You can have 390 spins in 30 minutes, 780 spins in 1 hour. You can't buy any other entertainment product with this kind of speed. It's clear that it's going to addict you after 1 hour. You have to reduce bet size. You have to have personal playing cards, perhaps personal gambling license, as its driver's license, is its license to carry a weapon. You would have worse breaks of play. You have to restrict the ATM access. So I know I'm running out of time, so I have concluding remarks. I have used already 40 minutes, 45 minutes, so I think that I'm coming to end, but I will show just briefly, gambling is not harmless entertainment. Gambling harm awareness program, if you work in the treatment, this kind of terminology, problem gambler, responsible gambling, you have to be aware that it's difficult to use these kind of expressions. They are always used by industry. They claim that it's only a small portion of the population that it's having issues. They are people who can't gamble responsibly. They are somehow defected individuals, but it's the products that are dangerous. There are products that are designed to addict. One should say where to seek assistance, how to discontinue gambling, how have to mandatory breaks, how to take out the money of the machine and leave for 10 minutes. There should be warning information that it's specific to game type, like in case of gambling machines. You have thousands of them in casinos in Slovenia. There should be warning like among the people who use machines, the rate of serious gambling issue is 5 times the population average. Or you can say that if you gamble 1 hour with this machine, you lose 71 euros. That is amount in Finland that people approximately lose in one machine only in 1 hour, 71 euros. That's the cost. If you compare that to going to soccer game, going to movie, it's very high. Price information disclosed in a simple manner. You have this, which I just said. How to address crime, suicide. We have public policies on prevention. You have to restrict availability access. That's the case with alcohol, case with tobacco. You can do it in online environment also. You can block the ISP as they do in Germany now in some cases. And if you have more severe gambling problem, more inclined you are to do crime or be involved with criminality. You would have to restrict the amount of venues in deprived areas. You have to limit the incitement of gambling. No free bonuses, no this kind of VIP schemes, no this kind of incitement of gambling if you are already in the rock bottom. Negative effects, we have noted in Finland, you have instant loans, access to credit. Many people gamble with credit. They simply don't have assets to have the high amount of gambling all the time without taking credit. It's almost always the mark of serious problem gambling. This should be prohibited. In Finland, we have a high amount of instant loan providers, high amount of payday loans that are almost always financed or taken because of the gambling. How to have effective regulation? You have to have transparency, access to public documents. You have to use the freedom of information requests. So we have had cases in Finland that we have had to go to court to have the documents from the government, but we have used this also with reporters and with help of other people. There should be some visits to gambling venues, what is actually happening, not to rely on gambling providers who say that it's normal activity, there is nothing happening, there's nothing to see. You can do mystery shopping, there should be research that it's based on observations. I have done observation studies in Isle of Man, in Malta, in other locations, so you can go there and see what is happening. So it's something that gambling companies can't prevent. Then there is this focus on prevention. Of course, treatment is very important, but you have to prevent the issues. You have to create barriers of entry. You have to create compulsory gambling cards. You have to provide schemes that are placed protection of the people and not that just for the marketing purposes, not just regular gambling schemes placed there because of the company, because they give the loyalty card. So summary. And I'm now at the end. So gambling is a major source of inequality. Government and industry doesn't want responsible gamblers. They want sustainable gamblers. They want gamblers that come again. They want gamblers that continue gambling. They want gamblers that lose little amounts all the time so that nobody notices. They are harmful products and services. It's like gambling with machines. It's more like tobacco. It's not like alcohol. It's addictive. After 1 hour, you are addicted if you are gambling several hours in a day. Problem gambling is so difficult. I would refrain of using that. I would say excessive gambling. It's that what the gambling industry wants. It wants the gambling excessively. No gambling company makes profit from people who throw occasional lottery ticket, few euros in a month. That's not profitable business for them. Thank you.
Okay, we are honored to have you here, Janne. Thank you for your presentation, a deep insight into the subject. Can I suggest that we show our faces to the attendees so they can see us who's talking? And I would also like to invite, I would, well, we plan to spend next 10 minutes for discussion and questions and answers. And if you let me follow up with Mirna, I would like to ask you whether she would like to comment on any of this.
First of all, Janne, I'm glad to see you, and I'm really happy that you joined us. Thank you for this valuable presentation. And I will actually just follow your line of reasoning and thoughts with the concept of responsible gambling, for which I believe that it's just not enough and is not working. And it will be short presentation, but I will stress some of the arguments that you already put. And my presentation will be in Slovenian language, but slides are in English so that you will be able to follow. That's for now, but I'm glad that you showed us so many facts and numbers that we rarely see. Thank you.
Thank you, Mirna. Great to see you also. I'm looking forward to this presentation. I will stay, definitely.
Tine, would you like to comment on any of this?
Hello. I would also like to thank for this wonderful presentation. I think it was really rich with research and numbers, which is quite lacking in this field, as mentioned. That it's clear there is nothing good for society in it. And I think the responsible in government should be aware of that. I think they are not just corruption. It's, at least in Slovenia, I think it's also the lack of awareness of the problem.
Absolutely.
Okay, I would like to encourage our attendees. If someone has a question, you can put it into our chat window, and questions will be answered. Well, if I may jump in with a question, what do you think? What is the best option for regulating gambling in any country, any specific country? What is the best public health approach to gambling? Which gambling regimes works the best? Is it this monopoly system, licensing system, or a combination of both?
Thanks for asking. That's a very important question, and I think that it's something that we also published an article last year with my colleague Michael Egerer from Germany and one colleague of mine, Virve, again, Marianne from Finland. And we looked at the research on monopolies and licensing. And also we have some stuff of that with the book with Mirna that we published in 2018. We had these gambling policies in European welfare countries, and we had some chapters about this issue. Thank you, Mirna, for showing that and advertising our joint work. I think that it's important to keep in mind that it's not so much about system itself. It's only a vehicle or means to end. So it's meaning something that, like here in Finland, in our neck of the woods, we have had monopoly for 80 years, and still we have very high rate of problem gambling and very high rate of machine gambling. We have had 30% of adults gambling with machine, 30. It's very high if you think like in the UK, there is 3 or 4 or 5% of the adult population. Why is that? Because of the availability, gambling machines in every grocery, every milk shop, every kiosk, every 9-11, every 7-Eleven. And this is something that government is keen to do. Is nobody's doing research and nobody's questioning and nobody's raising the public discussion. And if you have licensing in Sweden, they have very high public discussion about whether the licensing companies are acting responsible manner. Now last year they closed down a license of Ninja Casino that had market of 20% of online gambling. They thought that the gambling is very excessive. So in licensing system, you can take out the license. You can say that you are out of business, you are out of the market. But in monopoly system, who is going to take out the license of Finnish gambling monopoly? Who is going to take Finnish gambling monopoly to court of law? Who is going to say to gambling monopoly that you have to close down this venue? Nobody's doing that. That's the difficulty that we have been facing here in Finland. And that's something that you have private actors. You can say that it's problematic, but that you have private business, private wealth. But when we have doing the studies in Italy, the private profits, it's not always so high compared to public profit. It's the case that you can control in a better manner. You can say that you have to close down this venue, you have to take down these machines, you have to take this and that away. And that's something that I would say that it's very important.
Okay. Could you comment on the situation in Norway? They, in the 90s, they decided that they will not benefit from gambling. What is their situation?
Yeah, Norway is very peculiar, and it's perhaps the case that Norway is somehow difficult. It's like the state of Alaska in the US that I mentioned in my presentation. The difficulty is that Norway is very rich on oil reserves. It's not difficult, it's of course benefit for them, but it's that they don't really need the gambling money. They have billions in their bank accounts because of oil that they are pumping from the Nordic Sea, and they noticed that almost the money that's going directly to the NGOs or civil society organizations such as Norwegian Red Cross, the people from the Red Cross said themselves that we don't want to have this money anymore. This is creating too much problems. But this is something that didn't happen in Finland. We had 4,000 beneficiaries from gambling. We had almost every organization that you could think of having money from the gambling company here in Finland, and almost nobody was saying publicly anything against gambling. Even the Christian-based organizations didn't say anything, and that's difficulty when you earmark the revenue. And in Norway, they did that. They placed all the money to the taxation, and the support is that way. And I think that's something that's important. And one thing that they did well was that they took out almost all the machines from public places. They took out the gambling machines from kiosks and groceries, and they replaced them with machines that are not designed to addict, well, that they demanded that they are designed to prevent addiction. The new current machines, the Bellazzo, as they are called, and the other machines which are located, they are very dull. There is almost there are no bells and whistles, there are no colors, there are no ringing bells, and there are no this kind of sirens when you win. There is a text, you win, you lose. Nobody almost in Norway wants to play them.
Okay, we are running out of time for discussion. Maybe just one more, a short question that was sent through the chat window. How do you tackle online gambling in Finland?
That's a very good question, and I think that it's something that in Finland, the difficulty is that for a short background, just one sentence, we have a duopoly, which means that we have a Veikkaus gambling company in mainland Finland. Then in our archipelago, which is independent in a sense, there is a PAF, which is an online gambling company, and they have gambling in ferries and boats and things like that. And this kind of online environment has been inciting Finnish gamblers already for decades. And this is very difficult for us to prevent any actions in this kind of scheme where we have our own offshore gambling company, you would say, here in Åland. It's located in a Swedish-speaking minority that has independence to some extent, and they want to use the money for their own purposes. And Finnish government can't do much about that. So our situation is peculiar, but you can see it from Germany that in case of online gambling, you can do certain things. There is now German federal regulator that is going after one provider, and they say all to internet providers that if you accept traffic from this company, you will be banned by the regulator. So it means that if you are an internet service provider, you don't want to do that. And that's something that the regulator can do. Another thing is with the online gambling companies, like they have been doing in UK, they want to have a point of sales tax if they license somebody. So it's also the case in France. You have to be the local operators. Otherwise, your internet service provision is shut down. So that's something that people always discuss, that we can't regulate the internet, but we regulate and tackle with child pornography. We tackle with many issues in internet. It's not the case that it's Wild West.
Yeah, I would like to thank you for your answers and the whole great presentation.